was younger, I struggled with a lot of identity issues and a lot of being comfortable in my own body, also with roles, who I was supposed to be and how I was supposed to act. It led to a lot of issues of depression and struggle in my life, and eventually I turned to controlling that, or controlling those emotions with substances, illegal drugs. And drugs have a way of masking all those emotions and covering that up. So my name is Natalie Marie, what's her name? Sofina Mayorga. I identify as genderqueer, and also trans entity, because I am transitioning, and so that's a part of who I am. Sometimes I'm more masculine, sometimes I'm more feminine. And I'm more comfortable with the idea that it's not something that's static or has to be. And I can evolve and grow and change and be a unique, dynamic person. My addiction led me to commit crimes of theft, usually stolen property, things like that, to make money to feed the addiction. It became the most important thing to me because it was what kept me going. And so that was what ultimately led to my long-term incarceration. While I was incarcerated, I struggled a lot with my identity and my sexuality as well, and also things about my personality and who I was, as a person. When I came to realize what I was, or how I was, and how I identified, it was not readily or accepted in the prison setting. So I tried to access healthcare several times while I was in there, identifying as trans and genderqueer, and was denied categorically every time. Their policy is simply to recognize a person's birth sex and how they were at the time they were incarcerated. There was no help for me, access, no counseling, no referrals, no examinations, anything like that. So yeah, a lot of that, the access to healthcare, I faced a lot of discrimination while I was incarcerated. And had there been, more access to it, I don't think I would have had as many problems as I did while I was there. There are a lot of gender nonconforming, gender variant, and trans people incarcerated. It's not something that's well publicized, I think, or researched, but there definitely are. Everywhere I went, there was people just like me who were struggling with things just like me. And we all have a similar experience when we're incarcerated. There's a lot of, first off, discrimination, obviously, from staff, but also from the population, the inmate population. There's also safety concerns. A non-trans identifying person can go through their prison sentence in a relatively low-key manner if that's what they choose to do. And a trans identified person cannot. Everything they do is put under a microscope. If there was a policy of providing adequate health care to people, I think that would change the dynamic. It would change it to an environment that promoted understanding. After coming out and being provided with the health care that I feel I need, my world is completely different. I no longer struggle with those things. I don't have even the least desire, or people say impulses, or cravings, triggers or cravings for drugs. It's like all that went away. All the struggles, all the internal struggles, all the pain, all the suffering, all the depression. I'm a very happy person these days. And I'm successful in the things that I do because I have confidence, and I know who I am, and I can accept that now.